Dr. Michelle Francois, National Epidemiologist, Ministry of Health, Wellness and Elderly Affairs. The Ministry of Health, Wellness and Elderly Affairs is closely monitoring the recent surge in measles cases in the region of the Americas. The World Health Organization estimated that there were 10.3 million cases of measles globally in 2023, representing a 20% increase from 2022. This increase in cases was accompanied by just over 100,000 measles-related deaths, mostly occurring in children under 5 years of age. According to an alert issued by the Pan American Health Organization, PAHO, as of the 21st of February 2025, 268 measles cases have been confirmed in Argentina, Canada, Mexico, and the United States of America, with the latter recording its first death since 2015. The number of confirmed cases in 2025 represents a significant increase compared to the same period in 2024, when only 60 cases were reported during the first 8 weeks of the year. The Centers for Disease Control and Prevention in the United States of America reported 3 separate measles outbreaks, and as of February 27, 2025, a total of 164 measles cases have been recorded. Of those, 95% were either unvaccinated or had an unknown vaccination status. 20% required hospitalization. Confirmed cases in the United Kingdom continue to soar as well, with England recording 91 confirmed cases in 2025, with the age group of 1 to 4 years representing almost 30% of the total cases. Given the highly contagious nature of measles, combined with low immunization levels globally, the likelihood of outbreaks continues to be cause for concern. In 2023, 57 countries reported large measles outbreaks. Measles is a highly contagious viral infection which spreads when an infected person breathes, talks, coughs, or sneezes. The virus is airborne and can remain infectious in the air for up to 2 hours after an infected person has left the area. A single infected individual can spread the virus to as many as 10 to 20 susceptible people. The time between infection and illness averages 10 to 12 days, but may extend to as many as 21 days. In the early stages, the clinical picture may resemble that of the common cold, with fever, runny nose, and cough, but later is accompanied by red and watery eyes, small white spots inside the cheeks, and the characteristic rash, which appears on the face, along the hairline, and spreads downwards towards the rest of the body. Children under 5 years of age and individuals over 30 years old are at higher risk for severe complications such as diarrhea with dehydration, lung infection, blindness, and inflammation of the brain, which may progress to death. There is no specific treatment for measles, and management is focused on relieving signs and symptoms and preventing complications. Immunization is considered one of the most effective measures in the prevention and control of measles. The World Health Organization estimated that between 2000 and 2023, measles vaccination prevented more than 60 million deaths worldwide. The mumps, measles, and rubella vaccine, or MMR vaccine, is available at wellness centers across the island at no cost to the public. 2 doses of the vaccine are recommended to ensure immunity and prevent outbreaks. The vaccines are given as part of the routine childhood vaccination schedule at 12 months and 18 months of age. Since measles has a high infectivity rate, the threshold for community protection is also very high, requiring at least 95% immunity among the population to prevent outbreaks. As of 2023, MMR vaccination coverage in St. Lucia was 85% for the first dose and 83% for the second dose. St. Lucia has not recorded a confirmed case of measles in decades. However, our low immunization rates mean that the island remains susceptible to a measles outbreak if a returning national or visitor is infected. The following guidance can help keep you and your family safe. Ensure that your child receives both doses of the MMR vaccine as per the recommended vaccination schedule. If you or your child are unsure of your vaccination status, contact your nearest wellness center for guidance. Before you travel, ensure that you are aware of measles outbreaks in your destination country. Remain vigilant for signs and symptoms of measles, particularly if you or your child have had contact with individuals from regions experiencing outbreaks. Follow proper hygiene practices, including regular hand washing, covering your mouth and nose when coughing or sneezing, and staying home when unwell. This may help to prevent the spread of infectious diseases. The Ministry of Health, Wellness and Elderly Affairs remain vigilant and will continue to provide frequent updates to the public.